Hello everyone. Good evening. I am Dr. Vyshnavi, your ENT faculty on this Unacademy platform. Today we are here to discuss the topic surgeries in ENT. So we will be discussing some incisions. We'll be discussing some surgical procedures, doing a little bit of MCQs during this discussion. Let me just first understand from all of you. Are you all able to hear me and listen to me? If yes, kindly give me a thumbs up in the chat box. Let me just first understand from all of you. Good evening, Kaushal Suman. Yeah, so I think the audio visual relay is fine and it's good to go. So we will begin the class. While we have more learners joining in for the class, let me quickly tell you what we have on offering from Unacademy. We have the NEET PG 2023 final summit batch. This is arranged in 3 modules. We have module 1, which is an emergency room module for the month of December. We have module 2, frequently forgotten volatile topics, for the month of January, and for module 3 we have most expected questions in the month of February. So this is going to prepare you for the examination and help you get a 360-degree understanding of the subject in the last very few days of your examination. If you are interested, you can log in, or you can join the subscription with this 9,999 only, and you can use the code ENT live to get another 10% off. And this has started from 16th of December. I have done my classes on 16th of December, and the rest of the classes are going on. This is a 3-month duration course, and there is a more than 85% strike rate come in from the similar session that we conducted last year. We are also coming up with prof subscription. So we have for MBBS Prof 1, Prof 2, Prof 3, and now my ENT courses recorded session is live on Unacademy app. So if those of you who are interested in listening to the recorded version of ENT from me, you can go to this app of Unacademy and you can see the recorded version. So let's begin with the incisions that we use commonly for any ear surgeries. So the first incision here is called as Rosen's incision. This is also called as endomeatal incision. So Rosen's incision is also called as endomeatal incision. Here the incision begins from 12 o'clock position to 6 o'clock position, about 6 to 8 mm away from the annulus. So you take an incision from 12 o'clock to 6 o'clock, about 6 to 8 mm away from the annulus, and then you reflect this whole thing as a flap. This incision is called as Rosen's endomeatal because you take it in the external auditory meatus, typically in the bony portion of the external auditory meatus. So we call it as endomeatal incision. It is used for 2 surgeries. It is used mainly whenever you are planning to do a myringoplasty, or if you are planning to do a tympanoplasty. So for a myringoplasty or for a tympanoplasty, you will use this incision. The next one is called as your Lempert's end oral incision. So Rosen's was endomeatal, Lempert's is end oral. So what is end oral incision? This incision begins again at the same position, 12 o'clock position to 6 o'clock position, but this is not in the external auditory meatus bony part. This is at the bony cartilaginous junction. So this is not exactly in the bony part, but this is at the junction of bone and cartilage, which is called as bony cartilaginous junction. So this is present at the junction of the bone and cartilage. Now if you just take from 12 o'clock to 6 o'clock at the bony cartilaginous junction, so this is your bony part, this is your cartilaginous part, then you call it as end oral type 1, Lempert's end oral type 1 incision. But if you connect this incision up to the level of incisura terminalis, then you call it as Lempert's end oral 2. So if it is only in the bony cartilaginous junction, it is 1, and if it is connected to the incisura terminalis, then it is Lempert's end oral incision type 2. Again, endoral incisions are used whenever you want to repair the tympanic membrane for myringoplasty, or if you want to do a tympanoplasty, you can use this Lempert's incision. So if it is only in the bony cartilaginous junction from 12 o'clock position to 6 o'clock position, it is Lempert's endoral 1. And if it extends up to the level of incisura terminalis, then we call it as Lempert's endoral 2. Okay, so this is the incision that we use for myringoplasty and tympanoplasty. The next one is called as post-oral incision. This is also called as Sir William Wilde's post-oral incision. So what is post-oral incision? This is an incision that begins behind the pinna from the highest point of the pinna. So this is your helix, the highest point of your helix. This is your first landmark. The second landmark is the tip of the mastoid. So this is your highest point of the helix. This is the tip of the mastoid. About 1 centimeter behind the retroauricular groove. So about 1 centimeter behind the retroauricular groove, you have this post-oral incision. So highest point of the helix to the tip of the mastoid, 1 centimeter behind the retroauricular groove, you have the post-oral incision. So Yashwant is asking me what are the different indications for Lempert's 1 and Lempert's 2. So typically Lempert's 1 is used whenever you're trying to reconstruct you're only trying to reconstruct the tympanic membrane, or you want to inspect the middle ear. But if you want a wider exposure, like you want to do a stapedectomy or a stapedotomy, you want to also harvest some connective tissue from the canal skin, you want to make the canal become more wider, then you're going to take the Lempert's endoral 2, because when you release the attachment of the cartilaginous part, the canal becomes more wider, giving you a better view of the middle ear. Okay, so for a wider exposure, when you see bony overhangs of the canal, or if you feel that the surgery is not just limited to myringoplasty and tympanoplasty, you want to do like say ossicular reconstruction or stapes reconstruction, in that situation you will take Lempert's 2. So basically incisions are always a surgeon's convenience. There is no specific right or wrong incision. If I am comfortable doing an endomeatal approach to a middle ear, I will do endomeatal. If I am comfortable doing an endoral approach, I'll do endoral. If I am not comfortable with both, I'll go post-oral. Okay? So fine. Now what do you think is this surgery here? What sort of surgery has been depicted over here? Look at the image and try to answer in the chat box. Good evening, Debraj. Thank you, Rakesh. So can anybody tell me what is this what surgery has been depicted over here? Yes, Debraj, this is definitely a mastoidectomy, but what sort of mastoidectomy? Is this a cortical mastoidectomy? Is this a modified radical mastoidectomy? Canal wall up or canal wall down? What sort of procedure is this? Very good, Rishabh Sharma. It is canal wall up procedure, also called as cortical mastoidectomy, also called as Schwartz operation. This is also called as canal wall up surgery. So these are different names for the same surgery. So if you exenterate all the air cells of the mastoid, beginning from the tegmen, which is the roof of the mastoid, posteriorly the sigmoid sinus, and anteriorly till the facial nerve, and inferiorly till the tip of mastoid, if you remove all the air cells of the mastoid, we call it as cortical mastoidectomy. So if you see this posterior canal wall of the external auditory canal, this is the posterior bony wall of the external auditory canal, it is intact, it is not yet we have not removed it. So if this posterior canal wall is intact, we call it as intact canal wall mastoidectomy. So we are not doing anything to it. That is why we call it as intact canal wall mastoidectomy, also called as cortical mastoidectomy, also called as Schwartz operation. Got it, Debraj? You wrote it as MRM. It's not MRM, it's cortical, also called as Schwartz operation, also called as canal wall up surgery. And whenever you do cortical mastoidectomy or modified radical mastoidectomy, you will always use William Wild's incision, which is your post-oral incision. Okay, now look at this. Look at this image and tell me what is this. Superiorly, the roof of the middle ear, the tegmen tympani and the tegmen antri are continuous with each other. So there is a communication between the middle ear and the mastoid, and also the bony canal wall between the external auditory canal and the mastoid has been removed. There is no canal wall now. So what we have converted now, we have converted the entire middle ear, mastoid and the external auditory canal into one single cavity. So what would you call this type of a surgery as? What would you call this type of a surgery as? Where everything, the middle ear, the external auditory canal, the bony portion of the canal and the mastoid is converted into one single cavity. You're right now, Debraj. This is called as modified radical mastoidectomy. This is called as modified radical mastoidectomy. Now, since we are removing this posterior canal wall, ideally there would be a bony canal like this. This has been removed, because of which the facial nerve is exposed. So if we remove that posterior canal wall, then we call it as canal wall down surgery. So hence this is also called as canal wall down surgery. Now whatever are the preserved structures, like the ossicles, like the mucosa of the middle ear, which are not infected and not involved in the disease, are retained. We are not doing anything with that. But if we remove the complete mucosa, complete ossicles of the middle ear, complete muscles, the tensor tympani and stapedius, everything of the middle ear mastoid is removed, and the eustachian tubal opening in the middle ear is plugged with fat, making this entire cavity a dead cavity. That is radical. So entire mucosa removal, muscles removal, ossicles removal and plugging the eustachian tube with fat is radical. This is modified radical. Here you are converting the middle ear mastoid and the canal into one single cavity and trying to preserve as much as non-infected ossicle, non-infected mucosa and help eustachian tube ventilation to be there, so that it is still what a functional cavity and it is not a dead cavity. So this is your canal wall down surgery. So I hope you got this. Now what is this? This is your external auditory canal bony portion. This is your mastoid. This is your bony part of the external auditory canal. It is intact. So can I say this is the tegmen, which is the roof of the mastoid? This is the tip of the mastoid and this is the sigmoid sinus? Yes. Now this is your facial nerve. Let me draw it with another color. So this is your facial nerve. This facial nerve is giving a branch called as the chorda tympani nerve in the vertical course of the mastoid. So this space between the facial nerve, chorda tympani nerve, and this is present incus superiorly. We call it as fossa incudis. So this space between the facial nerve, the chorda tympani nerve and the fossa incudis superiorly, we call this space as facial recess. It is a recess between the facial nerve and its branch. That is why it is called as facial recess. So facial recess is bounded by vertical portion of the facial nerve, chorda tympani nerve and fossa incudis above. So this space is called as facial recess. So facial recess approach is used to approach the round window, especially whenever you are doing a cochlear implant surgery. So please remember, the word facial recess approach is used for cochlear implant surgery. Now, are we opening the middle ear from the bony canal wall? No, we are coming from a posterior route. That is why it is also called as posterior tympanotomy. Tympano means middle ear, tomy means opening. So if we make an opening into the middle ear, not from the external auditory canal, but I am coming from behind, from the mastoid, we call it as posterior tympanotomy. Just one second. So opening into the middle ear via the posterior route is called as posterior tympanotomy. I hope all of you got this. It is used for cochlear implant surgery. Okay, so answer this question. Tympanoplasty is an operation aimed at correction of hearing in perceptive deafness, eradication of infection and correction of hearing, drainage of mastoid abscess, correction of hearing in otosclerosis. So please answer this in the chat section. What is tympanoplasty? Very good. Rishav, Debraj, very good. So tympano means middle ear. The word tympano means middle ear. Plasty means repair. So repair of the middle ear is called as tympanoplasty. Now why are we repairing the middle ear? Obviously if there is an infection, you want to repair that infection, remove the infection, which is why you are doing this surgery. Now only infection removal is our aim, or we also want the function. Why do we have external, middle and inner ear? We have the ear for the purpose of hearing. So when we are doing our surgery, our aim is not just isolated for removal of infection. We also want to maintain the purpose for which that organ was built, which is hearing. So tympanoplasty is aimed at hearing correction as well as eradication of infection. So this is an operation aimed at eradication of infection and correction of hearing. Now there was an MCQ in the current INI-CET examination on the types of tympanoplasty with a match the following type of question. So it's very easy. Now whenever we do a repair of tympanic membrane and we try to do an ossicular reconstruction, we have to lay a graft. Usually we take the temporalis fascia as the graft, and if we place this temporalis fascia graft on the malleus, so is malleus your first ossicle? Yes. So we call that surgery as type 1 tympanoplasty. So type 1 tympanoplasty is when the graft is placed on the malleus. Now if the graft is placed on the second ossicle instead of malleus, if the graft is placed on the incus, so when the graft is placed on the incus, we call it as type 2 tympanoplasty. So type 1 is on the malleus, type 2 is on the incus, type 3 is on the head of stapes. So if you see, this is your stapes. If the graft is placed on the head of stapes, we call it as type 3. Okay, what is type 4? Now the malleus, incus, stapes, all of them have got eroded because of the disease process, and the graft is placed on the foot plate of the stapes. So that is called as type 4. What is type 4? Type 4 is a surgery where the graft is placed on the foot plate of the stapes. Type 5. Instead of placing the graft on malleus, incus or stapes, you make a new window. This new window is made in the lateral semicircular canal. This is called as fenestration operation because you're making a new window or a new fenestra. And what is sono-inversion? The sound has to take a path. It has to travel from the oval window to the round window. That is the normal path of sound. But if we reverse the process by placing the graft on the round window, the sound impulses will go from the round window and hit the oval window later. This we are reversing the process of sound transmission, which is why we call it as sono-inversion. So type 6 is sono-inversion. So I hope all of you know the Woolstein's classification now. This is called as Woolstein's classification of tympanoplasty, where we have got 6 types of tympanoplasty. Okay, can anybody tell me what is this that you're seeing here? What are these images showing you? Yes, I'm waiting for your answers in the chat box. Something in otosclerosis is what Debraj is saying. Others have any idea what is this? See, there is some prosthesis over here. One second. Now is it fine? Is it working, everyone? Is the audio visual working now? I hope things are better now, at least better than before. Okay, so if we'll just finish this topic and stop. So basically this is ossicular replacement prosthesis. Yes, we'll just stop after this, Debraj. I'll again continue from here, maybe some other time, because I think there is some problem with the internet. So this is an ossicular replacement prosthesis. If you have partial discontinuity in the ossicle between incus and stapes, if there is a partial discontinuity and you replace it with a a prosthesis, we call it as PORP. What is PORP? Partial ossicular replacement prosthesis. But if the ossicles are completely absent, here also still stapes is present, so this is a PORP. But if all the ossicles are absent, malleus, incus and stapes is absent, and you are replacing with another prosthesis, this is called as TORP, total ossicular replacement prosthesis. So this is TORP, total ossicular replacement prosthesis. Okay, so whenever you're trying to do an ossicular reconstruction, you will use a ossicular replacement prosthesis. If it is partially replacing, we call it as PORP. If it is completely replacing, we call it as TORP. Okay, is the audio visual fine now? I think it's better now. Okay, so this is basically stapedectomy with placement of prosthesis. So here we have removed the entire stapes. You can see malleus is present, incus is present, but stapes has been completely removed with the foot plate, and there is a piston that is now hanging from the incus to the oval window. So when you remove the entire stapes along with the foot plate and replace it with a piston, we call it as stapedectomy with replacement of prosthesis. So with this I will stop the class for now, because I think there is a little bit of lag on and off. We will take the class forward tomorrow or day after tomorrow again. I'll keep surgeries in the year part 2, where we will discuss further surgeries, gynecological surgeries, laryngeal surgeries, etc. So for now we will stop the class. I hope to see you all again in my next class, and I'm sorry for the interrupted connectivity of the internet. Sometimes things are not under our control, but obviously I cannot do anything about it. But next class we will continue from here and do the surgeries in the year part 2. Okay, take care.